Today we'll see the new topic of breast disorders, that is mastitis. So today we'll see three disorders continuously. So breast disorders. Okay, already we have seen the anatomy of breast well regarding the reproductive system and breast self-examination we have finished. Now we'll see disorders of breast. The first thing is mastitis. Mast means breast, itis means infection. So inflammation of breast lobes and the surrounding breast tissue is known as mastitis. If you see the breast structure, see this nipple area and this around that mass is known as the surrounding tissue. So if it is getting infected, then it is known as mastitis. It is an inflammation of breast tissue characterized by, if any infection is there, you will see pain and swelling, redness, warmthness and fever. You will see most common symptoms. Wherever you feel itis, no, you can write all these symptoms. And mastitis most commonly affect women who are breastfeeding. Why? Because the baby will suck the nipple. Sometimes the baby will bite the nipple. And also not only that, over secretion of milk also, they will stagnate there and cause inflammation of the breast tissue. So etiology mostly it is because of bacterial streptococci. You have no bacteria is of two types, streptococci bacteria and staphylococci bacteria. So fungi, blocked milk ducts in breast and cracks on nipples or sores in the nipples, injury to the breast and nipple piercing. So these can be seen in the, these are the causes. So blocked milk ducts in the sense I already told you, overproduction of the milk. So after some time, no, if you put milk for one day outside, how it will be like cuddles, like a cuddle one and a curd one, isn't it or not? So same like in the breast also, if the baby is not emptying the complete breast, some milk will be retained there and it will be turned into a curd, so it will obstruct the milk ducts. And nipples, sore nipples where the baby biting and injury to the breast sometimes externally, and nipple piercing. So these are piercing, nipple piercing is in the sense same, the baby will bite the nipple. So through the cut also sometimes the bacteria will enter into the breast. So types of thing, puerperal, non-puerperal. So puerperal mastitis is known as lactating. Puerperium period is known as immediately after the delivery until the mother, that means you understand later. So you think that 3 months after the delivery. So mostly lactating period. So that is, if that time the breast is getting infection and it is known as puerperal mastitis or lactational mastitis. And what is non-puerperal? Non-breastfeeding mothers. So if the normal woman is getting the mastitis, inflammation to the breast, then it is known as non-lactating mastitis or non-puerperal mastitis. So what are the clinical manifestations? We'll see. Swelling of the breast, tenderness, breast pain, skin redness. Affected area should be looks like bumpy, lumpy and red, fatigue. So diagnostic evaluation mostly history collection, physical examination, chest x-ray, mammography, breast ultrasound, breast MRI. So what are the treatment? You will see antibiotic drugs. Mostly this is a bacterial, no, you will give antibiotics. Analgesic you will give for pain. So a symptomatic treatment, if fever is there you have to give fever, pain is there you have to give analgesic, like that. So others include trying infant latches correctly, otherwise the baby will bite the nipples, and massaging or lumping if pumping the breast while breastfeeding, so that the breast will completely empty. And make sure breast drains completely during breastfeed. Apply cool compress or ice packs to your breast after breastfeeding, so that if any lumps are there, no, it will dissolve. So this is about the mastitis, inflammation of the breast. So inflammation of the breast, it is of two types. Again I am taking the review. It is of two types, puerperal mastitis and non-puerperal mastitis. What is puerperal mastitis? No, when breastfeeding mother is having no infection, that is known as puerperium. So puerperium period is nothing but after the pregnant, immediately after the baby birth, up to 6 months is known as puerperium period. So that period, if the mother is having any infection, that is known as puerperal mastitis. If normal woman is getting ante without any breastfeeding, then it is known as non-lactating mastitis or non-puerperal mastitis. You know, in IT sense and symptoms, So that all redness, pain, fever. And what are the causative factors ante? Because of any obstruction to the ducts and the baby biting and any other cracked nipples, piercing nipples, like that. If you see, the breast will get infected. Mostly the infection will be caused by two organisms, Staphylococcus bacteria and Streptococcus bacteria. So treatment will give antibiotics and analgesics. So others include, so before, prevention is better than cure. So before only you have to latch the baby correctively. So massage the breast while giving breastfeed. You put ice cubes every after the breastfeed, and also you have to sure that every breast is drained completely. This is about the mastitis. Now we'll see what is breast abscess. So abscess in the breast, if you see red color one, no, a small lump, okay, small mass in the breast is known as abscess. So when a pocket of pus forms in the breast is known as breast abscess. A pocket of pus is nothing but a bag, a small bag of a pus. If it is collected in the breast, it is known as breast abscess. Sometimes a bacterial infection can cause pus collection. So breast abscess can be painful and requires urgent medical treatment to avoid complications, as it is, a pus is a next form of infection, isn't it? So if it is no pus, only light infection, and it's okay, with antibiotics it will cure. But if pus formation is there, it is a second stage of infection, somewhat serious. So we have to give immediate medical treatment to avoid the complications. Now etiology includes same bacterial, streptococci and staphylococci, and we have sometimes fungi, candida, and blocked milk ducts in the breast secondary to mastitis, injury to the breast. Types include same, amma, we have two types of abscess, non-lacting and lacting. Lacting I already told you, during the puerperal period or breastfeeding time, and non-lacting, it includes the non-breastfeeding women's, normal women's. So clinical manifestations, swelling of the breast, you will see tenderness, same pain in the affected breast, skin redness, affected breast look lumpy and red, nipple discharge, same like that only. Same diagnostic evaluation, history collection, physical examination, chest x-ray, mammography, breast ultrasound, breast MRI. See, these are the common tests you can write for breast disorders, that is mammography, chest x-ray, breast ultrasound and breast MRI. Same thing you can write it. History and physical examination. So treatment includes same antibiotics, analgesics, drain the pus with syringe and through the insertion. So where the pus is located now, first of all you have to locate the area. You have to put small cut on that area and you have to collect all the pus from the breast. So other, do not breastfeed with infected breast, as the baby is very weak immune system, so the baby will get infection. So you should not breastfeed. After breastfeed, clean the nipples with areola and with sterilized wipes, and keep the breast clean daily by soap and water. Apply warm compress. Now we'll see gynecomastia, the one more condition in the breast disorders. Till now we have seen mastitis, breast abscess, and now we'll see the gynecomastia. So gynecomastia, if you observe this, these are male body. So what is gynecomastia? So if males are having a bilateral enlargement of mammary gland. See, if you observe the male's chest, so there will be no breast tissue and there will be nipple and there will be areolar, but in a very a small structure, isn't it? But if you see this gynecomastia cases, they have a large prominent nipple and areolar, and also they have a breast tissue. So gynecomastia is defined as an increasing in the amount of breast tissue in boys or the men. It is caused by an imbalance hormonal changes. How a females will get facial hair, no? And like that, some males also will get breast tissue due to hormonal imbalance. So gynecomastia can affect one or both breasts. Generally, gynecomastia isn't not a serious problem, but it can be tough to cope up because as they are males, if they have breast, no, they feel very shy. So psychologically they may feel, but it's not a serious disease condition. So men and boys with gynecomastia sometimes have pain in their breast and may feel embarrassed. So what are the etiological factors? I told you, no, it is because of testosterone hormone, decreased testosterone hormone and compared with the estrogen, and use of anabolic steroids used to enhance the athletic performance. So that's why, these athletics, after some time they will be like a libido, they don't have any sexuality. So why? Because they will use more steroids. So clinical manifestation: swelling of the breast tenderness or the pain. So diagnostic: mostly physical examination, history collection and blood test, chest x-ray, bust ultrasound, same thing. Treatment: most of the gynecomastia resolves over time without any treatment. So medication used to treat breast cancer may be helpful for the men with gynecomastia like taxomiphene. These are the drug used in cancer. Aromatase inhibitors. So these can be sometimes useful. So surgery, this if any again they are having more problem ante, they can go for mastectomy. So they will remove the test gland tissues from the breast. The surgery is often done using only small incision. It is not that much important. So breast self examination, already we have seen breast self examination. So this is about some of the disease conditions of breast. Okay, breast disorders. So we have seen breast. Now next class we will see the tumors. Okay, so in your mastitis we have seen breast abscess, we have seen gynecomastia, we have seen, and one more condition is there, breast engorgement and tumors of the breast, that we will see in the next class.